Welcome to Givers, where we enroll, support, and pay family caregivers through state programs. We're here today with Elizabeth Ayoola to talk about how all the different Medicare parts work together. Elizabeth, you are Nerdwallet's Medicare and retirement expert. So maybe you can say hello and then just give us like a high-level overview of the different Medicare parts, A, B, C, and D, and what each of those covers.
So my name is Elizabeth Ayoola, and I am a personal finance expert. I often cover Medicare topics. I cover retirement, banking, and essentially any topic around finances that helps you build a strong financial foundation. And now to get into Medicare, we have four moving parts of Medicare that people should be aware of, and that's Part A, B, C, and D. I'll quickly break down each. So Part A covers inpatient hospital care and related services. Part B is more outpatient care. So it covers things like doctor's appointments, for instance, and other types of outpatient medical care. Then you have Part C, which is also known as Medicare Advantage, and that covers the same benefits as Part A and B, but is offered by private insurers, which is important to note. And then you have Part D, which covers prescription drugs. Now I can quickly go into what each does. So essentially Parts A and Part B work together, and they're called Original Medicare. And it includes, as I said, Medicare Part A, which is hospital insurance, and Medicare Part B, which is medical insurance. And that's managed by the federal government. So Original Medicare covers inpatient and outpatient hospital care. Now moving on to Medicare Part C, which is also known as Medicare Advantage. It is essentially a more comprehensive, or I would say like an all-encompassing alternative to Original Medicare. And it includes Medicare Part A, Part B, and usually Part D, which, as a reminder, is prescription drug care. Additionally, you can get dental and vision with your Medicare Advantage plans also. And then you have Medicare Part D, which I would say is probably the most straightforward. So that's essentially just prescription drug coverage.
Awesome. So that was like a great overview of sort of all the different parts. I'd love to talk more specifically about how they work together, or, if you only have parts A and B, what gaps in coverage are there, et cetera. So maybe we can start exactly there. If you have Medicare parts A and B, so original Medicare, what gaps in coverage are you facing? Like what might you not be covered for if you have those?
Yes, I would say the most important things people should think about in terms of gaps for Part A and B are, first of all, cost coverage gaps. Gaps in dental, vision, and hearing, and then also just maybe relatively high out-of-pocket costs for the prescription drug or Part D coverage. So I'll quickly go into each. So in terms of the cost coverage gaps with Original Medicare, you're still responsible for a certain amount of healthcare expenses, like your co-insurance as well as your co-pays. Now, for this reason, you probably may need something called Medigap and Medicare Part D in addition to supplement those costs or those gaps. For people who are not familiar with Medigap, it's essentially additional insurance you can buy from private health insurance companies, and it covers deductibles, copays, and co-insurance that Medicare or Original Medicare doesn't cover. So it's often recommended that you get that as well. Now, in terms of the second thing I mentioned, dental, vision, and hearing coverage gaps, Original Medicare usually does not cover routine dental, vision, and hearing services. So what that means is you may have to buy a standalone dental, vision, and hearing plan if you want to get that coverage as well. In terms of prescription drug coverage gaps, as of 2025 or January 1st, 2025, which is this year, people with Medicare Part D will have an annual out-of-pocket cap of $2,000 on prescription drugs. Now, for people who were spending more than that last year, because the cap was higher last year, and before that, this may be good news, but for some people that still may be too high. So that's something to consider as well, depending on your budget.
So I think we'll get into maybe how to make up some of these gaps. You mentioned Medigap, and I know we're about to talk about Part C, Medicare Advantage. Before we get into Medicare Advantage, or maybe simultaneously, can you talk about the difference between the two, why someone might want Medigap over Medicare Advantage? Maybe it's all sort of bundled into the same thing. Just I get confused. So maybe you can help clarify that.
Before we go into maybe why you would want Medigap versus Medicare Advantage, I think it's a better question as to whether Original Medicare or Medicare Advantage is a better plan for you. Because you may be going with Original Medicare, which we'll probably talk about later, because maybe it gives you certain features you want, or you have access to maybe a certain wider range of providers or more nationwide access. So in that case, Medigap may be kind of a better fit for you. But if you're relatively healthy and you go for Medicare Advantage, then obviously you don't have to worry about Medigap. So I would say kind of the decision making in that is whether you fall better into the Medicare Advantage or original Medicare bucket.
That's super helpful. And it is a better question. And so, spinning off of that, maybe you can talk about Medicare Advantage, what it is, what it covers, how that works when you're, buying through a private insurer, and maybe some considerations people might have when they're choosing a Medicare Advantage plan.
Yeah. So just to recap, Medicare Advantage is also known as Medicare Part C. And like I said, it just can be a more comprehensive way of getting health care. So if you don't want to buy all those different moving parts, so if you don't want to have to buy original Medicare and also add on Medigap and also add on Part D, this is kind of one way to bundle up all of those things and get most of the things that you need in one place. So some benefits of Medicare Advantage is that it's private and, as I said, more comprehensive. So you may get your vision and your dental and your prescription drugs all in one place. So things to consider if you do decide to go with Medicare Advantage is one, coverage isn't always as pervasive as original Medicare. So what this means is you may be limited to basically some coverage because it doesn't include nationwide coverage, as you may be limited to your coverage area. So maybe if you live in a more remote area or you want more access to different providers, then this may not be the plan for you. Also, another big thing, especially if you have an existing health condition, is that you may need referrals. So depending on the plan that you choose, you may require specialist referrals, which can be inconvenient or maybe even frustrating for people who need them often. That said, it can be ideal for people who don't need as much flexibility and again are relatively healthy. Another thing that can be frustrating for some people is that networks and coverage can change from year to year. So if you have a serious health issue, you may not have access to the specialist that you prefer because maybe one year they're in network and another year they're not. So those are some things people should keep in mind.
Okay, I think that's super helpful. It obviously sounds more comprehensive instead of needing, A and B and now Part D and Medigap on all these sort of add-ons. Can you talk a little bit about where Medicare Part D fits in, what people should look out for if they're choosing to add on Medicare Part D? And then this is a question that I didn't ask you in advance, but I'm curious about is if you have original Medicare, do you need then to get Medicare Part D also? Like, is that sort of a necessity?
I'll start with the last first. So you don't have to get Medicare Part D, but if you know that at some point maybe you're going to need prescription drugs or you already do because you have a existing healthcare condition, then you should probably sign up for Medicare Part D because it doesn't automatically come with original Medicare. So that's something you're going to have to sign up for separately. Now, quickly back into what Medicare Part D does is essentially prescription drugs for people with a Medicare plan. Some things to think about with Medicare Part D, and maybe this is a good point with you saying that do you have to sign up for it with original Medicare? If you choose not to during your initial enrollment period, then what could happen is that you end up getting late enrollment penalties. So that's something or a pitfall that people should be aware of. Now, you can enroll in a standalone prescription drug plan, aka Medicare Part D, or a Medicare Advantage plan that includes Part D prescription drug coverage during your initial enrollment period. For people wondering when that is the 7-month period starting 3 months before the year that you turn 65. Now, if you wait until after that initial enrollment period, again, you could end up paying penalties, but you can still enroll during the annual open enrollment period. And for Medicare Part D and Medicare Advantage plans, that's October 15th through December 7th of each year. So that period recently passed. I'll just, I guess, mention two other things to be aware of, and that's choosing a plan that doesn't align with the prescription drugs you need. So it's so important to take inventory of the prescription drugs you're currently using, maybe ones that you might tentatively need to use in the future, and then think about which plan best aligns with that and offers you kind of the best package. And then the last one that I'll mention is restrictions on coverage. So sometimes Medicare Part D plans can come with restrictions like prior authorization or quantity limits. And this, as you can imagine, can be frustrating for people who need important access to medications. So you want to think about that as well when choosing a plan.
Awesome. You had mentioned earlier about like dental and vision not being included in original Medicare. If someone needs those things, wants those things, how do they add that on to their coverage?
So they would actually need to get a standalone plan in most cases, which again can be an additional cost, or consider Medicare Advantage, since many of the plans, not all, but most of them come with dental and vision. Yeah.
Okay, awesome. And then I guess so at Givers, we're supporting family caregivers who are often family caregivers are taking care of a loved one in their family. What are some things that family caregivers need to consider when helping their loved one navigate what plan to choose, what coverage they need, etc.?
So, at a high level, again, in order not to confuse people, I would say there are three main things people should be thinking about. So, for their loved ones, so that's the amount of coverage they need, and in terms of like the features and things like that, their loved one's budget, and also their health status. I'll throw in a bonus one, which is your lifestyle. So, I can quickly go into each of those. So, first, you want to think about the most important coverage features for you. Some features can include the level of flexibility that you need when it comes to things like pre authorizations, access to network providers, ability to move and travel, and just overall flexibility. If you need more flexibility, for instance, Original Medicare may be best for you since they have nationwide coverage, for example. Next, you want to think about your budget and what you can afford. So, you want to think about how much you can afford to pay in out of pocket costs. And you want to consider premiums, copays, deductibles, and any other out of pocket costs you might have. So, for example, if you can't afford Medigap and you have an existing healthcare condition, Medicare Advantage may be better since Original Medicare actually has no cap on out of pocket costs. So, that means if you have an existing healthcare condition and you can't afford Medigap, you could end up owing thousands of dollars paying for care, right? Another thing you want to think about is your health status. So, if you're relatively healthy and you only need healthcare services, let's say a couple times a year, then you may consider Medicare Advantage, right? However, if you frequent the doctor, then an Original Medicare with a Medigap plan may work out cheaper for you. And then the bonus one is your lifestyle. So if you like to travel often, then you may want to consider Original Medicare, since again, it has nationwide coverage and you may be able to get access to any healthcare services you need, no matter where you are in the country. And what that can do is minimize or eliminate your need to go out of network.
Awesome. I think that's super helpful to like as a starting point. And then once someone's considered all of those things, do you have any recommendations for tools or resources where people can compare Medicare options and find like what is the best option for them?
Yeah, so there actually are quite a few handy tools. So, first of all, people can just start on the Medicare.gov website. They have lots of resources and tools on there that can help you choose a plan. Also, the tools on there can help you compare costs, which is a big one because for most people, they're probably looking for the most efficient plan where they have the least out of pocket costs, right? NerdWallet also has a range of Medicare related resources that people can use. Another thing that people can try is contacting their state. They can find Medicare savings programs that can lower their Medicare costs. That may be a resource for people who are worried about the cost. And they can also check eligibility for other programs that can help with health related costs. There are also licensed Medicare insurance brokers or agents, and these people are specialized in helping people choose plans. So if you have gone through all the information and you're like, this is still too detailed and confusing for me, you can reach out to an agent who can basically look at your situation and guide you to which plan is best for you. And then lastly, you can also contact Medicare directly. They do have a phone number. The only thing to be aware of is sometimes the agents can't give you personalized advice. So they may give you, but still guide you towards a decision and maybe answer any pressing questions that you have.
Awesome. I mean, this has all been like super helpful. I think having a high level overview of how all these parts work together can be really helpful for people because, like you just said, even helping my dad navigate his Medicare coverage is like there's so many moving pieces and who needs what. So I really appreciate your time, and we'll be sure to link, you and all the resources you just mentioned in the show notes so people know where to access all of this.
Perfect. Thank you so much, Katie.
Yeah, awesome. Thanks so much. We'll talk to you soon.